Hi YouTube fam, I am Angeline, the nursing assistant. Welcome back you guys. Welcome to Informative Friday. Some of you guys are new. I have been getting a lot of new subscribers. So let me tell you something about my channel. On Tuesday is Chit Chat Tuesday, and I will be talking about anything from A to Z. What is my experience as a nursing assistant? What kind of problems I have been going through as a nursing assistant, and also I will talk about some of my co-workers' problems or issues as a nursing assistant. So you see guys, on Chit Chat, you will get anything. It's no telling what you'll get on Chit Chat. So don't forget to come back on Chit Chat Tuesday. And on Friday, I will try to give you a more informative videos, something educational, something you may want to know about. You need to check out my videos, the salary of a nursing assistant, the obstacles of a nursing assistant. So I'll give you a wide range of information on Friday. And please, you guys, the ones that is looking at my YouTube channel, I see you. I'm so happy that y'all enjoy my content, but please hit that like button. That helps my channel to be to grow, help my videos get out there in front of different people. So if you would, please just hit that like button, and if you're not subscribed, just hit that subscribe button. It's not gonna cost you not one thing. So let's get started in this Informative Friday. Okay, you guys, on this Informative Friday, we will be discussing operating room nursing assistant. What do they do? What is their responsibility? Generally speaking, an operating room nursing assistant job is to take care of the patient before, during, and after the surgery. Also, they have to keep the area clean and sterilized before, during, and after surgery. Also, they will assist the surgeon and also assist other members on the medical team as needed. So let's get into the more specific of what a nursing assistant does in surgery. I'm going to piggyback on what I said, generally what a nurse assistant job duty were, but we just gonna get into it more. When I said keep the area clean and sterile, meaning you have to keep the surgical room clean before the surgery, and then you have to go back in and clean it after surgery, and it have to be sterile. Also, you have to sterilize the instruments, the surgical instrument, and they usually have a machine that they call the autoclave machine. You will have to put these instruments in that machine in order to get them sterile, because everything have to be sterile in a surgery room, OR, operating room. Before the surgery starts, you actually have to set up the surgery room, and you will have to know what instrument goes with what, with the different surgery. For example, if you have a total knee replacement surgery, you will have to know what instrument that for that specific surgery, and you would have to get those instruments and set up the surgery room, so when the doctor come in, everything is all in place. You will also have to help them get dressed. And what I mean about get dressed is, in a surgery room, everything have to be sterile. So that is above clean. It have to be sterile. So when putting on their gowns, it's a certain way they have to put it on. They don't want to touch nothing. So sometimes we have to assist in getting them dressed and getting ready to go into surgery. If the patient is an in-house patient, and what I mean about in-house is if the patient is actually in the hospital, you will have to go and transfer that patient from the room to the surgical room. Also, you will have to verify the patient information and make sure that the procedure that is performed on the patient, make sure it's the right procedure and the right patient. Also, during surgery, you will have to pass the surgeon different instruments as requested. You will be doing vital signs during this surgical procedure, and you will be keeping a record of that. Also, if something need to be taken, a specimen or something need to be taken to the lab, you will also be running all lab specimens during the surgery. Sometimes you will have to assist the surgeon in basic medical need, like putting a clamp on a area that need to be clamped off, or maybe helping him with a wound, or helping him cut open area. So you will be very busy in the surgical room. You would not just be a spectator looking at what's going on. You will actually be in the action and doing all kinds of things in the surgery room. And after everything is over, the surgery is done, you will have to transport this patient to the recovery room and just oversee the patient, make the patient comfortable. And that is basically it, which is a lot. It's a lot. But it depends on different facilities, what your level is. Some facilities, you have to go through a training course, because in some of those areas, when you go to nursing assistant school, some of those, like a sterilization instrument and knowing what instrument go with what surgeries, are not taught in your nursing assistant class training. So most facilities, you will have to get more training in order to work in OR, but most of the facilities, they will train you there. You won't have to go back to school for it. They will actually train you on the job site. I have worked in OR as a nursing assistant, and I did not have to go back to school. I was actually trained at the facility, at the hospital. So that, I hope that gave y'all some kind of insight. If y'all were thinking about being an OR or nursing assistant, it's definitely a venture. You know, you see all types of surgeries. You know, when I first started, I was like in awe. I just loved it because I was so fascinated with it. And it's a great, you know, area to work. And I hope, you know, if this is the area that you was thinking about it, working, I hope it gave you some kind of clue or some kind of insight on what you will actually be doing in OR. So you guys, I'll see y'all next week on Chit Chat Tuesday. I hope y'all enjoy your weekend. So if you would, subscribe, like, and hit that notification bell, because you don't want to miss not one of my videos. Not one. Come on, let's get it started.